It's Psoriasis Awareness Month, and in this video, I'm going to be giving you 5 tips to get control over your psoriasis. Before I do that, give this video a thumbs up if you like skincare content from a board-certified dermatologist. Subscribe and make sure you turn your bell notifications on. That way you know as soon as my videos go live. Follow me over on TikTok and Instagram too, because I'm very consistent with skincare content on those platforms as well. Psoriasis. It is a condition that affects about 125 million people worldwide. That's roughly 2 to 3% of the population. And if you know somebody with psoriasis or you've heard of it, probably what comes to mind is, oh yeah, a skin problem. People have skin lesions that are flaky, scaly plaques, and they also can have flakiness in their scalp. They can have nail findings, but what people fail to understand is that psoriasis is actually an inflammatory condition that can impact a variety of other bodily systems. About 30% of people with psoriasis have a type of arthritis that can be very debilitating. It's called psoriatic arthritis, but there are a whole host of other problems that people with psoriasis face. People with psoriasis are more likely to suffer from addiction, especially to tobacco and alcohol. And because of the high levels of inflammation throughout the body, people with psoriasis are more likely to suffer from heart disease. They're also more likely to have strokes, unhealthy cholesterol levels, fatty liver disease, kidney disease. They can have eye problems, problems with the gums, and they're also a lot more likely to suffer from an underlying mood disorder such as depression or anxiety. People with psoriasis often struggle to maintain a healthy weight and either are often overweight or obese. They can have high blood pressure, diabetes, and there is a strong association between psoriasis and the inflammatory bowel disease, Crohn's disease. A lot of people with psoriasis end up having Crohn's disease as well. Now, the tips I'm going to be giving you in this video are going to help out a lot if you implement them, but I want to make it crystal clear. Psoriasis is a chronic inflammatory condition. There is no cure for it. It goes through periods of remission where you have no skin lesions and maybe you feel great, but it can and does often come back. It requires ongoing treatment, management. It's not something that just burns out and goes away. So keep that in mind. There's no quick fix. Tip number 1, you have to quit smoking. A lot of people with psoriasis struggle with addiction to tobacco, smoking. And this is one of the worst things that you can do. It's sabotaging control over your psoriasis. It sabotages the efficacy of medications as well. When you smoke, you're basically pumping in a lot of inflammation, which is already pretty high in psoriasis and what contributes to the skin findings and then later on joint problems. If you can quit smoking, this will have a lot of benefits for you and for your psoriasis. It will reduce the risk of the associated heart disease, high blood pressure, stroke. It also reduces the risk that you will go on to develop gum disease. If you're able to quit smoking, you can expect fewer flares of the skin lesions and better remission overall with increased periods of remission. And by remission, I mean periods of time where you have no skin findings. There is one subtype of psoriasis that's very, very stubborn to treat and can be very debilitating and goes along with psoriatic arthritis. It's called palmoplantar pustulosis. If you smoke, it's very, very difficult for that to calm down. So you can reduce the severity of that condition by quitting smoking. Quitting smoking is not easy. It's very challenging and many people try and fail. So it requires multiple attempts. So if you have tried in the past and failed, that's okay. That's perfectly normal to have failed. I mean, that is normal. Don't beat yourself up. That is to be expected. But you have to keep trying again and again. I suggest talking to your doctor, your dermatologist, seeing if there isn't something that they can arrange for you to help you out. There are a variety of treatments to help people stop smoking, counseling. There are a variety of things out there, so don't give up. You've got to try again. I would encourage anybody out there, regardless of if you have psoriasis or not, to quit smoking. It is single-handedly one of the worst things you can do for your health and for your wallet. With inflation, yeah, cigarettes are expensive. Number 2, limit your alcohol consumption. This is really important because people with psoriasis are at an increased risk for having struggles with alcoholism. Why? We don't know. People who consume alcohol in excess, they have more stubborn psoriasis, and it tends to be more resistant to treatments. What do I mean by excessive alcohol? For men, that's consuming more than 2 alcoholic beverages a day, and for women, that's more than 1 alcoholic beverage a day. People with psoriasis who consume alcohol in excess, they notice many times that they have few to no periods of remission and that their treatments, seem to not work. But if they're able to stop or, significantly cut back to the recommended no more than 2 a day for men and no more than 1 a day for women, well then all of a sudden it's like, wow, this treatment is working. Limiting alcohol can also reduce the risk of you going on to develop psoriatic arthritis, which is very debilitating and not, something that you want. And it also will decrease the risk of fatty liver disease, which people with psoriasis are at increased risk for at baseline. So you would want to add on to that risk by consuming something that is hepatotoxic, meaning a liver toxin. Speaking of hepatotoxin, many psoriasis medications, they can potentially have adverse effects to the liver, especially one called methotrexate. Now, if you drink alcohol, that risk increases substantially. So generally speaking, for that medication, as I'm calling it out, we counsel patients to really limit their alcohol consumption. So yet another reason to be motivated to really limit your alcohol consumption. Not only, does it open the window for more remissions and less overall severity, but it also reduces the risk that you will develop fatty liver disease, and it reduces the risk that you will develop adverse liver effects from your psoriasis medications. One of the most important reasons to cut back, limit, or eliminate in total alcohol consumption in people with psoriasis, and that is the mental health consequences of drinking alcohol. Patients with psoriasis have a high associated risk of depression, mood disorders. I pointed that out at the beginning of the video. Alcohol is a depressant. If you have depression, regardless of psoriasis, I would strongly encourage you to stay away from alcohol because it is a deadly combination. But at any rate, having alcohol in moderation here and there, it's not forbidden. You have to look inward. If it's something that you feel has become a problem, definitely seek out help. All right, number 3 can be equally as difficult to hear, but it is the truth, and that is make an effort to maintain a healthy weight. I said this at the beginning, it is a fact. Many people with psoriasis, not all, but many people with psoriasis really struggle to maintain their weight. Many people are overweight or obese, and this puts you at risk for a variety of cardiometabolic problems, diabetes, high blood pressure, fatty liver disease, heart attack, all sorts of health problems. And if you have psoriatic arthritis, it makes it more debilitating. Research supports weight loss for people with psoriasis who are overweight or obese. Losing weight, if you are overweight or obese, can reduce the number of psoriasis flares that you have. It can reduce the need for more psoriasis medication. It can improve how well your psoriasis treatments work, and it can decrease the risk of you developing other conditions that are associated with psoriasis, like fatty liver disease, heart attack, unhealthy cholesterol levels. For people who are overweight, after losing weight, many patients report that all of a sudden their psoriasis medications start working when they weren't working in the past. So it really can have a profound impact on the control of your skin lesions and the internal associated problems with psoriasis. But studies show that a 5% reduction in body weight for those who are overweight actually can make a huge difference. So don't feel as though you have to go through a radical body transformation to get better control of your psoriasis. Small changes that are sustainable for you can really make a huge impact on your skin disease and your internal body health. If you are struggling with your weight, if you're overweight or obese and you have psoriasis, I suggest strongly talking to your doctor about the best approach for you. Don't go online and Google, weight loss tips. Don't go to social media because you're just going to get inundated with a bunch of fluff And honestly, crash diets, which nobody should go chasing after, they're not effective. They can be more harmful in the long run. Instead, talk to your doctor. If necessary, they can refer you perhaps to a dietitian to help you with food choices, if that's something. And that some patients also benefit from psychological counseling when it comes to weight management. Tip number 4, make sure you're eating a healthy diet. Again, don't go chasing after any kind of crash diet or fad diet in an effort to lose weight. Make sure you're eating a healthy diet and that you are getting a good variety of nutritious foods in your diet. Again, here's where I really think, especially if you struggle with this, that having your doctor maybe refer you to a dietitian, I really do think that it can be helpful. Making sure that you're incorporating fruits and vegetables, which have anti-inflammatory compounds, certainly can bode well for you. What is the best diet for people with psoriasis? Unfortunately, we don't have research that really points to the optimal psoriasis diet. Following a healthy diet and limiting your reliance on fast food and processed sugary convenience foods, it can help in reducing your risk of associated diseases like cardiovascular disease, diabetes, unhealthy cholesterol levels. Again, this is something I strongly encourage you to talk to your doctor about and to possibly be referred to a dietitian if necessary, because online you're going to get inundated by these echo chamber communities of people singing the praises of certain diets for X, Y, and Z. Just because somebody says that their psoriasis cleared up, it doesn't necessarily mean that whatever they're eating helped or is going to help you, or it certainly doesn't mean that it cured it. So all that to say, listen to your healthcare provider about what the best way to go about eating and managing your food choices is going to be for you. Don't just go online because it's easy to get inundated with misinformation. Tip number 5 is incorporate exercise into your life in whatever way is manageable for you. This is going to have a tremendous impact for you. It's helpful for managing stress. People with psoriasis, they do have a lot more stress, mood issues, depression, anxiety, and exercise actually can help with that. It doesn't have to be some complicated workout routine. Something as simple as going for walks is really helpful. This will help lower inflammation in the body that ultimately can help with your psoriasis in terms of improving remissions and response to treatment. Exercise is also going to be very helpful for weight management if that's something that you need to work on, and it's helpful for sleep, which feeds into your stress, which overall is going to help out your skin in the long run. And getting some exercise in, because it reduces inflammation throughout the body, it's going to help not only with your skin problems, but reduce the risk of those associated health problems like heart disease, unhealthy cholesterol, fatty liver, diabetes. Now, I mentioned this early, and it's quite true. 30% of patients who have psoriasis deal with a really debilitating arthritis, psoriatic arthritis. So if you have any pain when exercising, doing something like walking, definitely talk to your healthcare provider because there are a variety of different types of arthritis that patients with psoriatic arthritis can have, different joints that can be involved. It's not always just the hands. They can have problems with the joints in their back and their hips. So if you're having pain, definitely bring that to the attention of your doctor. So those are the 5 tips. But one thing I want to leave you with is, as I said at the beginning of the video, there is no cure for psoriasis. It's something that you're going to have and take with you for the rest of your life. So it's really important to stay consistent with following up with your dermatologist and your healthcare provider, your healthcare team, because these other things that I mentioned, heart disease, diabetes, it may be necessary to undergo screening for those things. And seeing your dermatologist regularly is really important. We are the dermatologists, we are the experts in managing the skin problems with psoriasis and looking out for all of the associated health problems. A rheumatologist, that's a joint doctor, they're also the experts in managing the joint problems, the arthritis. And a lot of times, dermatologists and rheumatologists work very closely together to take care of psoriasis patients. In fact, in certain areas of the US, there are clinics that are staffed by dermatologists and rheumatologists together taking care of patients with psoriasis and other conditions where you have skin and joint problems together. Following up regularly with your dermatologist can help in controlling the skin lesions, and that can have a tremendous impact on your quality of life. 60% of patients who have psoriasis report that it adversely affects their day-to-day quality of life. It gets in the way, and following up regularly with your dermatologist to optimize your treatment regimen, it really can make a huge difference in your quality of life. And with regular follow-up, your dermatologist can recommend if and when certain types of screening may be helpful for you. But I hope these 5 tips helped you guys out. I know when you have a chronic medical condition, whether it be psoriasis or anything else, it can be very isolating, negatively impact your quality of life, and leave you feeling as though you have zero control. But these are 5 things that you can begin in your own way to take control over, and it's gonna have benefit for your skin as well as your internal health. So I hope you guys enjoyed this video. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.